Okay, by our clock, it's 2 p.m. So greetings and thank you for tuning in to the latest installment of the Active Transportation Resource Center's webinar series. My name is Victoria Custodio, and I'm part of the Active Transportation Resource Center team that's based in Sacramento at the California Department of Public Health. As many of you are already aware, the Active Transportation Resource Center is a Caltrans-led statewide project that's been funded through the Active Transportation Program. Our mission at the Active Transportation Resource Center is to provide support to local agencies through the provision of relevant and timely active transportation-related resources, technical assistance, and training. I'll be serving as the facilitator for the webinar today, and as the title slide indicates, our focus will be on the Healthy Places Index, which I'll briefly describe now as an elegant and powerful tool that can bring an important data-driven lens to how we can better understand local community health needs and conditions, as well as disparities across geographies. So those of you who are on that endless search for data, this is the webinar for you. Next slide, please. Okay. As with all of our Active Transportation Resource Center webinars, our team is intentional in what we would like you as the attendee to learn at a minimum as a result of your attendance today. On that note, our two objectives for today's webinar are as follows. As a result of attending this webinar, you should be able to use the Healthy Places Index tool to identify and address community public health and health equity needs. And secondly, you should be able to understand how the HPI can be used by local jurisdictions and those that are supporting work at the local level, regional level, to assess and justify support for active and sustainable transportation initiatives. Next slide. We have a tremendous panel of speakers today. Our first team includes established presenters from the Healthy Places Index staff from the Southern California Public Health Alliance. Often referred to as the Alliance is a coalition of the executive leadership of 8 local health departments in Southern California. Its members have a statutory responsibility for the health of almost 50% of California's population. And the Alliance works to mobilize transformative power of local public health for enduring health equity. That presentation team from the Alliance includes Bill Sadler, who's the Director of Operations, Neil Maislish, who's the Senior Data Advisor, and then Helen Dowling, who's the Data Manager. Rather than having me explain what Bill, Helen, and Neil will respectively be covering in their presentations, I've asked Bill to give that as part of his presentation. Next, we have Alicia Brown, who is a Community Planning Project Coordinator at Walk Sacramento, where she works to meaningfully engage and empower residents to participate in planning processes. Alicia manages and supports several projects, including Safe Routes to School programs, active transportation planning, and policy technical assistance. She has a background in applying urban sustainability best practices across California with a passion for active transportation and smart growth development. And as mentioned, I'm Victoria Custodio. I'm part of the Active Transportation Resource Center team, part of the non-infrastructure technical assistance team here within the California Department of Public Health in the the Injury and Violence Prevention branch within the Center for Healthy Communities. Next slide. Okay. Please note that we will be recording this webinar and it will be posted to the Active Transportation Resource Center website at the web address provided. And we encourage questions throughout the webinar. Please use the WebEx chat feature at any time. However, we'll save those questions for after the presentations. Between our first 3 speakers, we may have time for 1 to 2 questions, but we'll have a longer Q&A after all presentations have been completed. Okay, and I have one last slide before we start our official featured presentation. And this is to do a quick poll of our attendees. So very shortly, you should be able to see two polls. The first poll is to let us know how familiar you are with the Healthy Places Index already. Your choices are very familiar, somewhat familiar, or not at all. And so I believe we can run both polls at the same time, and we are. Cool. Okay, and so the second poll question is, have you used HPI before? That's a yes or no. And if you've answered yes, please, we have a special request from the Alliance for you to actually enter details on that use into the WebEx chat feature now. So, and you can do that within the polling time. Actually, I don't know if you can do that within the polling time. You can? Okay. Very good. Multitasking system. We like it. So yes, but please share those details if you have used the HPI before. All right. So I'm going to give it about 5, 4, 3, 2, 1 seconds left. And then I think right now I'd like to close the polls and just give our speakers a sense of who's on the call. Okay. So for the first one, for the first poll, can you scroll down a little bit? It looks like we have most of our respondents, of our attendees that are on the call with us right now, we have about 50% who are somewhat familiar with the tool, and I wish they would give me percentage points. After that, we have those that are not at all familiar, and then we've got a few that are very, very familiar. So that's nice. And then the second question, we have, it looks like it's split between those that have used HPI before and those that have not. And so again, just one last reminder, if you have used the HPI tool before, please share those details in the chat box, and we'll make sure that that gets passed along to our presenters. All right. On that note, we're going to pass the presentation over to the Alliance. Bill, are you there?
Yes, I am. Can you hear me?
Yes. Okay. And so we're going to set up the slides, make sure that those are up. And Bill, can you see the slides on your end?
Yes.
Okay. All right. Take it away.
All right. Well, thanks so much, Victoria. We're really grateful for this opportunity to share the Healthy Places Index with you all today. And I'm really glad to hear that about half of you have used the tool or are familiar with it as well. So today we are going to give an overview of the Healthy Places Index, how it came about, the methodology, the key features and functions. And then we're going to dive in a little bit on how to use HPI for ATP applications. As probably all of you know, or most of you know, there's in this cycle, HPI is going to be added to the disadvantaged communities question. And so we want to make sure people know how to use it for that, as well as how to define project areas using the tool. And also in identifying health concerns, which is something that HPI has been used in the last cycle as well for. So we want to make sure everyone knows how to use the tool for these specific purposes. And then I also will give a little bit of an overview of current use cases, including places that have used HPI for ATP. So first, I want to provide a little framing for why the tool came about. So at the Alliance, we have a shared value statement. We believe that every Californian should have the opportunity to live a healthy life. However, we know that our health is shaped dramatically by community characteristics like housing, education, economic, and other social factors, which are often themselves shaped through policy. This diagram on the screen is the Center for Disease Control's Social Determinants of Health framework, which identifies broad factors beyond healthcare that impact health. These determinants of health also vary greatly by community. At the Alliance, we wanted to create a tool to identify health disparities, but also to promote policy action and ensure the equitable distribution of state and local resources. Our entire approach is rooted in health equity and the social determinants of health. So we asked ourselves, how do we quantify and communicate the impact of community conditions to spur policy action enough to address health inequities? Next slide. And so our response to this challenge was the development of the California Healthy Places Index, which is visible on the online map here. We'll return to this map a little later in the presentation, but first I want to talk about, or we're going to talk about how we arrived here, and I'm going to turn it over to Neil to talk about the methodology.
How you doing? Can folks hear me okay?
Yes.
Okay, great. So as you can see, we have the CDC social determinants of health slide on the left, and then we have the California Healthy Places Index policy action areas, and you can see through the color coding that there's a certain symmetry there. And we worked with a steering committee made up of local health departments and state health department and other folks to help refine the CDC framework. And as you can see that, economic, education, social, neighborhood are all common to the two frameworks, but we also had refinements that particularly singled out housing and transportation as being important sectors to have indicators on. The idea behind the Healthy Places Index is to pool over all of these areas which we know have big influences on health, to come up with an overall score that really reflects the cumulative impact of all these living conditions that are experienced at the census tract level, at a very fine geography. This allows us to rank census tracts across the state on sort of the healthiness of the living conditions in the communities. And this was a multi-year process in which we had versions of the HPI out there being used. We got a lot of user feedback, including folks at the ATP program who are trying to fill out their applications. And a lot of the improvements actually were driven by users and community groups and advocates to meet their needs. We have the next slide. I'll talk a little bit more about the HPI, because we're well aware that there are many different indicator projects out there, but our project has some very unique features that aren't really part of others. One is the granularity. As I mentioned, we operate at the census tract, but we also, it's scalable and scopable to higher geographies. So you can see the variation within cities or counties, which is really important because we often know that the variation between census tracts within a county can be as great as differences between counties. So it has this fine, granular approach. But it also scales up to cities, counties, and other kinds of policy-relevant jurisdictions like state assembly districts and senatorial districts. The other thing is that we were much influenced by our choice of indicators by it has to be actionable. We know there's a lot of indicator projects out there that use pretty highfalutin mathematical techniques, but they become so obscure that you can't figure out, like, what do I do with this information? So the ability to link to policy prescriptions for each one of the indicators was really important. We've developed policy guides, and we'll talk a little bit about that later on, that really cover the whole range of those policy action areas or domains that you saw in the color coding previously. The other thing that our steering committee was very adamant about is that we needed to have a index that was validated with a health outcome. And this is where the HPI really stands out as being unique among indicator projects. It's calibrated in such a way that the overall score, as it increases, would suggest an increase in life expectancy at birth. So if you move the needle on a transportation or a housing or education or economic indicator and improved it, it would be reflected in increase in life expectancy at birth for that particular census tract. So that's a very important feature that we have with our index that doesn't seem to be part of other folks' approach. Okay, let's take a closer look at the index itself. It's made up of 25 individual indicators that have been grouped into 8 policy action areas. And as you see, boxes flash before your very eyes, you can see right underneath the title of the policy action area is a percentage. And that is one of our methodologic breakthroughs as well, is that we know that certain domains or certain policy action areas have a much bigger influence on health than others. And through our partnership with the Virginia Commonwealth University, we're able to leverage some statistical analyses. And you can see here in the economic domain that has a 32%, so it gets a 32% weight. Education is 19%, transportation is 16%. So the overall cumulative score reflects not only just the score within a domain, but also this weight as well. As you can see, many of the indicators are things that are very much in use and available through the American Community Survey and other kinds of data sources that people frequently use. So in the transportation sector, you can see automobile access and active commuting, which includes walking, biking, as well as transit. And many of the other domains are a lot of the usual suspects when it comes to creating indicator projects. So I think this gives you kind of a whirlwind tour. I'm not going to go through each one of the individual indicators. You're welcome to take a closer look through our tool. So I'm going to move on to the next slide and hand it back to Bill and Helen.
Thanks, Neil. So now that you've seen the backbone of the Healthy Places Index, let's return to the map snapshot that we shared before and talk about how we chose to display these data, which are available for nearly every census tract in California. Unlike many other indicator projects, the Healthy Places Index utilizes an asset-based, positive frame present in every aspect of the index in the map tool. That begins with our name, the Healthy Places Index, and follows to our indicators as well, so counting those above poverty instead of in poverty, for example. We also refer extensively to the healthy community conditions and the health opportunities in a neighborhood, not where it falls short. We deliberately chose a color scheme that reflects this positive frame. Instead of using reds or oranges, which are historically associated with redlining and other negative connotations, to identify communities with fewer healthy community conditions, we instead use shades of blue. We also built in easy-to-interpret infographics and accompanying descriptive text that shows users how their community compares to other neighborhoods in California. Let's see it in action. Here, we selected a tract in Costa Mesa. In this image, this census tract has an HPI score of 15.7. Let's take a brief moment to discuss exactly what this means. The overall HPI score, policy action areas, and individual indicators are all expressed as percentile rankings, so that means they're relative to each other. An HPI score of 15.7 means that this community has healthier conditions than just 15.7% of other census tracts in California. If this isn't an intuitive concept at first, don't worry. We provide descriptive text throughout the tool that explains in plain language what each measure means. Next, after you've reviewed the overall HPI score, you can take a bird's eye view of the policy action areas and how they contribute to the overall score. The little thumbnail visualizations next to the title of each policy action area are like the HPI score infographic, but in miniature. The position of the black bar indicates that policy action area's ranking. For example, here we can quickly see that transportation has the highest ranking and housing has the lowest, with the others somewhere in between. This can help guide you to the specific policy action areas and indicators or health opportunities that you could focus on for change. You can then click on any policy action area and get a drill down on how each of the individual indicators come into play, like this. In this case, we've clicked on the economic policy action area. You'll first see that descriptive text I told you about before, explaining this policy action area's percentile rank. You can also see all of the indicators contained within the economic policy action area. In this case, we have above poverty, employed, and median household income. The numbers and visualizations to the right of each indicator are again their percentile rank, so how this tract is doing on each indicator compared to all California census tracts. It doesn't show the population proportion of those above poverty, for example, but I'll point out where you can get that information in a moment. Looking at all of these indicators together, we can see that the above poverty indicator has a low percentile rank, yet the employed indicator has a much higher percentile rank, approaching the top quartile. Seeing these indicators together is important in terms of thinking about the types of actions that are needed. In this community, people are working, yet they don't have living wages. If you'd like to learn more about any of the individual indicators, you can get a full-size infographic, explanatory text, and if you're interested in this indicator's value, so that is the population proportion of those above poverty within this tract, you'll see that in our What Does This Indicator Measure section that I've highlighted here. If you scroll further, we've provided clear information on how this indicator is connected to health and specific policy actions that can improve this indicator. We worked with our communications advisory team and Berkeley Media Studies group to create a values-based and scientifically informed description on the connection to health. For example, the connection to health for above poverty reads, every household should be able to afford the necessities of a healthy life: medical care, healthy food, housing, education, and other basics. Research indicates that economic opportunity is one of the most powerful predictors of health. We found that these explanations describing the connection to health have been particularly useful as we engage with other sectors. While those of us in public health are very familiar with the concept of the social determinants of health, there are many potential users of the HPI who may not yet be. These help bridge the gap and help move our data into action. That's why we've also provided possible policy actions for every indicator in the HPI. This is what Neil was alluding to earlier with our policy guide. If you click on any of the highlighted headings under policy actions to address this indicator, it'll take you to our website here. It brings you to our robust policy guide with specific policy recommendations, sample ordinances, links to relevant reports, strategies and plans, templates, resources, and more. Our goal is to thread opportunity for action throughout the tool, from the positive frame and the explicit linkage to life expectancy at birth, to the simple to interpret infographics and our extensive policy guides. That brings me to a breakdown of the full policy guide for this indicator, visible here. This shows the full list of policy recommendations included under the above poverty indicator alone. The screenshot on the previous slide only showed the first two recommendations under the first column. So as you can see, our policy guides are really quite expansive. In fact, some of these segments link to longer policy guides specific to those policy action areas. So here under workforce development, we have education-related options that are more detailed in the guide centered on preschool or high school enrollment. What's more is there are 30 extensive guides available across the 8 policy action areas, one for each HPI indicator and a few guides available for some of the climate change decision layers built into the HPI. These guides are accessible directly from the mapping tool and through the healthyplacesindex.org website under the Policy Actions tab. I'll leave a URL for both of those at the end of this presentation. So I know I've already shared a lot about what the Healthy Places Index mapping tool can do. But we also took suggestions from groups like yours to build out additional features and functions to help make your work easier. From here, we'll segue into some of the specific tools that will make answering the public health question on the ATP application much easier. So with our HPI, you can view data at multiple geographies, not just at census tracts. This includes cities, school districts, and state and federal legislative districts, among others. We've also built in a broad selection of complementary decision support layers that provide additional local data beyond the Healthy Places Index. These include dozens of health outcomes, which could be useful in characterizing local health concerns for your ATP grant, for example. You can also quickly identify high and low ranked places using the Healthy Places Index or any other indicator of interest, including our decision support layers. For example, you might want to find the census tract with the lowest HPI score in your neighborhood, or the tract with the lowest prevalence of reliable transit access. This could help you prioritize particular neighborhoods or corridors for your ATP application. Most importantly for your application, you can also define custom project areas using our pool function, which lets you create pools of census tracts that better match your community, neighborhood, or project area. This will allow you to create an HPI score for the exact area of your proposed project or corridor. Finally, if you have your own internal data sets you'd like to view on the map alongside the Healthy Places Index, we've built in an upload function. This might be useful for identifying the location of schools in your project area, for example, if you're pursuing a Safe Routes to School program. I wanted to demonstrate 3 key functions today that will help with your applications. So that's ranking, using our decision support layers, and the pool feature. But you can also view tutorial videos for every function I just outlined on our website. They're linked here. I'll also leave the URL to our map and our website at the end of this presentation. So let's start with some of the ATP guidelines language. So on our map, I want to point out that census tracts that fall within the 25th percentile are dark blue. So we can see this in action on an example map here. So here we've zoomed in to central Sacramento. To orient yourself, the black border represents the county outline. You can already see that there are clusters of poor community conditions that stand out from the rest that I've circled here and here. All right, and so I'm going to also demonstrate how exactly to identify some of these local public health concerns looking at that particular neighborhood. So let's return to this neighborhood I circled earlier, and then we'll explore the HPI score, policy action areas, and individual indicators for a single census tract. I've clicked on one in the northern part of this cluster, highlighted in dark blue. Compared to other census tracts in California, it's really not doing well, particularly in economic, education, transportation, neighborhood, and healthcare access policy action areas. So these all impact life expectancy and thus health and would qualify as local health concerns. Now, if you're interested in looking at more traditional measures of health to include in your application, you can find these here under our View Indicators function. These are under our decision support layers. These are separate from the HPI but can be viewed on the same map. So for example, you can see in this list here we have health outcomes, health risk behaviors, we have a selection of climate change associated indicators, and various other decision support layers, as well as a complement of race and ethnicity demographic indicators as well. So you might be interested in looking at our health outcomes, for example, and the way you access those is by clicking on that health outcomes piece. Then you can find a layer of interest by clicking View on Map, and you'll see that the map view changes to show diagnosed diabetes here. So you can use this also in answering the statement of need for local public health concerns. You can either use the social determinants and community conditions that I highlighted in the previous slide. So those would be all the components of the HPI, but you're also welcome to use these health outcomes that are part of our decision support layers. And now I want to demonstrate this rank function. So this is how you would quickly identify the highest and lowest ranked geography in a given area. So if you wanted to prioritize a particular place for your project, this would be a good way to do this. So to get started, you click on our rank button here, and then you enter a location that you want to rank within. In this case, we're interested in ranking within Costa Mesa. So you type that in, you select the city of Costa Mesa, and then it will produce a list of all of the census tracts within Costa Mesa ordered by their HPI score. By default, it orders them from the lowest HPI score, so that is with the fewest healthy community conditions. If you are interested in viewing the opposite, so identifying the census tract with the healthiest community conditions, you can click those little arrows next to percentile, and it will reverse the sort order. So this might be, yes, with our custom project areas, this is demonstrating our pool function, which lets you, as I mentioned, define your own custom project area, and it will also allow you to get a recalculated HPI score for that area. So this might be particularly useful, for example, if you're working on a project in an unincorporated city, neighborhood, or along a transit or bike corridor. You can simply select those tracts that comprise the project area for your custom HPI score. So to go about doing that, you would select our pool function here on the left-hand sidebar. and then you select all of the tracts that comprise your project area. So in this case, I'm clicking on this handful of tracts here, and it creates a list of all of the tracts you're adding. If you would like to remove a tract, you can click the X next to the tract in the list under selected census tracts, or you can just re-click on the same tract again. When you've selected all of the tracts that are part of your project area, you can click Pool Census Tracts, and then it will recalculate the HPI score for that group of census tracts. And the great thing about this is not only does it give you an overall HPI score for those tracts, it also recalculates all of the policy action areas and all of the individual indicators as well. And you can also use this to get estimates of our decision support layers as well. So if you wanted to get an estimate of the health outcomes in your particular project area, you can create a pool here, go back over to our view indicators and our decision support layers, and also see an estimate for any of those layers of interest. All right, so with that, I'm going to turn it back over to Bill to talk a little bit about how the HPI is currently being used.
All right, thanks, Helen. So I know that was a lot of information on ways to use HPI. We wanted to highlight a few of the areas that are already using HPI beyond the active transportation program to give you a little more context for the different methods that HPI is being used, and then we're going to wrap up. So on the current slide, you see some of our use cases that from the state. So we currently have documented at least nearly 100 use cases from various local, regional, state agencies and community groups and other types of sectors that are using HPI. At the state level, though, we have about 30 state agencies that are using HPI for various purposes. We've bucketed them into 3 different categories. So ones like ATP that are using HPI for equitable grant making, where it's either being used for identification of disadvantaged communities or to be identifying health issues or concerns that can be improved through a grant. And so that includes the Caltrans Sustainable Transportation Planning Grants and Adaptation Planning Grants, the Strategic Growth Council's Transformative Climate Communities Program, ATP, and the Air Resources Board's Air Protection Program. Altogether, about $450 million is currently of grant funding, is currently using HPI as part of the selection criteria. So either using it as part of a menu of options for identifying disadvantaged communities or for health concerns. And then there are other ways the state is using HPI, including assessments and decision making. So the state health department is using it in various ways for different types of research and planning efforts. The Air Resources Board had a research call for a transportation access and built environment program. And then a lot of different planning guidance. You may see HPI recommended in the OPR General Plan Guidelines, a lot of the climate reports and plans that are coming out of the state, including Safeguarding California, and as well as Regional Transportation Plan Guidelines and multimodal corridor guidelines. And then it's also in the SB 1000 toolkit for developing general plans with an environmental justice element. Next slide. And then locally and regionally as well, there are the Southern California Association of Governments is using HPI as part of a grant program that they administer, the Sustainable Communities Planning Grants, as part of a health question and that application. Local health departments are using it in various ways to be prioritizing investments or to be conducting health assessments, including community health assessments and community health needs assessments. And like the state, there's a lot of planning guidance that is happening, whether it be with SCAG or other types of cities and counties that are integrating public health into various types of planning efforts. Next slide. And then finally, I just wanted to highlight an ATP-specific use case in Riverside County. They've used HPI as part of their a previous grant application for ATP in Cycle 4 and produced these maps showing areas where schools are overlaid with HPI data, and it's focused on the Safe Routes to School program. So this is one example of what Helen showed you in the demo of ways that you can use HPI and see where the communities of high need are related to different active transportation projects. So with that, thanks so much for bearing with us in this presentation. We hope it was really beneficial to you in understanding HPI and how it can be used for ATP and other purposes. And I believe we're going to turn to Walk Sacramento before we take questions. So I'll turn it back over to Victoria.
All right. Bill, Helen, and Neil, great presentation. Thank you so much. And as Bill just indicated, we are going to turn it over to Walk Sacramento, but I'm going to do a quick look at the chat function to see if we have like one or two questions that have come in that you know, if we can answer those at this point in time. Seeing none, we're going to turn it over to Alicia. Just give us 1 second to pull up Alicia's presentation. Alicia, how are you feeling?
Good.
Okay, take it away.
Great. So I'm Alicia Brown with Walk Sacramento, and I'm really excited to have been invited to talk about how we've been using HPI in our own work. And so next slide, please. So I first wanted to give a bit of background about who we are at Walk Sacramento. So we're a nonprofit planning and advocacy organization that focuses on improving quality of life and health equity through community-centered policy and systems change in land use and transportation. And we work with communities and local agencies throughout the Sacramento region to create healthy places that focus on moving people, not cars. We do this through a combination of policy technical assistance, planning and community engagement, and place-based programs such as Safe Routes to School. And so a large part of our work is focused on identifying health disparities in order to make the case for active transportation investments in communities. So we become really familiar with a lot of different tools and data sources that help us do this. And we've actually, we're tracking HPI throughout its development and had been using it since it came out. So we were really excited to add a new tool to our repertoire. And one of the reasons why we like HPI in particular is because of the strong focus on the social and physical determinants of health, which allows us to view indicators from a health and livability lens. Using this approach really helps us fill in some of the gaps from CalEnviroScreen as well, which is another tool that we've often used when identifying health disparities. However, we've often found that CalEnviroScreen doesn't tell the full story, especially in the Sacramento area. Our disadvantaged communities are less likely to face industrial pollution burdens as identified in CalEnviroScreen, but are still disproportionately vulnerable to and impacted by poor health outcomes as a result of the built environment. So this is just an example that I've highlighted that compares the same census tract across CalEnviroScreen and HPI to really show the difference in how these tools both identify disadvantage. And so when comparing the census tract, we can see that pollution burden is more heavily weighted than population characteristics in CalEnviroScreen, which results in the same census tract being in the 70 to 75th percentile for unhealthy conditions in CalEnviroScreen compared to the 1.3 percentile for healthy conditions in HPI. So again, showing that in HPI it's reflected much less healthy conditions than what CalEnviroScreen does. And taking a look at some of those indicators on the side of CalEnviroScreen that I've highlighted, you can see that the census tract is in the 99th percentile for CalEnviroScreen population characteristics, but only the 25th percentile for pollution burden. So again, kind of reiterating the heavy weighting for pollution. And while pollution burden is not a primary health concern in this census tract, there are still a lot of other key economic, education, and transportation-related vulnerabilities that have real impacts on health and livability, which are, again, you can kind of see in the HPI side of it that they have the really economic, education, and transportation are on the low end of the healthy conditions scale. And so ultimately, HPI's focus on health outcomes and livable community conditions more accurately reflects the common needs and priorities that we often hear from people in Sacramento, such as healthy food access, housing, and access to jobs, medical services, and schools. Because of this, we've advocated for its use in defining disadvantaged communities through the City of Sacramento and Sacramento County's SB 1000 environmental justice element processes. Next slide, please. So with all that said, I really wanted to showcase how we've actually applied HPI in making the connection between health and active transportation through our Safe Routes to Parks and Healthy Retail project. This project is a partnership with the Sacramento County Health Department and focuses on policy and systems changes that will improve active transportation access to healthy destinations. The goal of this project is to improve health outcomes in the county's priority obesity prevention communities through two approaches. So one, to facilitate exercise and healthy diets by making parks and healthy foods more accessible, and two, to improve active transportation access to these destinations in particular, thereby creating more opportunities for improved health through physical activity. Next slide, please. So one of the first things we needed to do as part of this project was to make the case for how active transportation investment to parks and healthy food stores would improve health. So using a social and physical determinants of health framework, we turned to HPI as a tool to gather pertinent data on socioeconomic characteristics and health conditions. And as with all projects, you want to start out by defining your project boundaries before collecting existing conditions data. And so that's what I'm showing here is that we luckily already had our project boundaries defined for us based on the health department's priority obesity prevention areas, which Helen actually highlighted earlier as kind of those two main areas that pop out in HPI when looking at Sacramento County. So this made it extremely easy for us to be able to pool all of these census tracts in HPI and to compare these community-wide indicators against county-wide averages. Next slide, please. And so this slide is an example of some of the indicators that we used and their comparisons to Sacramento County as a whole. And so we really dove into both a few key HPI indicators as well as those decision support layers, particularly a lot of the health outcomes decision support layers. And so hopefully it's easy to tell apart the blue from the green on this slide, but I wanted to use those colors to reflect what it looks like in HPI, where the blue is less healthy conditions and the green is for more healthy conditions. And as you can see, most of these indicators show that the two communities in North Sacramento and South Sacramento have much less healthy conditions than Sacramento County generally, where the only data point for healthier conditions than the county is South Sacramento's Urban Heat Island Index. And so next slide, please. So we pulled all of this information from HPI, but we still had to answer the question of how does active transportation fit into this picture? So to answer this question, we wanted to compare the North and South Sacramento communities with the Central City Core, which the Central City Core also has a much higher median household income than these outlying communities do. In looking at vehicle access, we found that the two communities are still generally rank in the 25th percentile with limited access to a vehicle, which is similar to the census, or similar to the Central City. So this would imply that people rely on active travel modes such as walking and biking in order to access everyday destinations, which would then imply that these three communities would have similar health outcomes if people are using active transportation and being more physically active. However, when we then compare our health outcomes, we see that obesity and chronic diseases such as diabetes are still much higher in our two North Sacramento and South Sacramento communities than in the Central City. So that left us wondering if each of these three communities have similarly low rates of vehicle access, implying that people are using active transportation and being more active, then why are these health outcomes so different? Next slide, please. And we argue that the answer lies in what these communities look like. The Central City in Sacramento has a denser mix of land uses and active transportation infrastructure that facilitates walking and biking and facilitates people being able to not use a car to get around to where they need to go. Whereas communities in North Sacramento and South Sacramento are much more auto-oriented and less hospitable to walking and biking. So by using this data in conjunction with what on-the-ground conditions look like, we can really tell the story of how investment in active transportation infrastructure can lead to improved health by making it safer and easier for people to walk and bike to everyday destinations. Next slide, please. This process of identifying health disparities in built environment conditions helped us redefine what park and healthy retail access means for communities in Sacramento. Traditionally, access has been viewed from the lens of density, or as the crow flies, percentage of people living within half a mile of parks and healthy food stores. However, access is more than how close a park or a grocery store is to your home. Convenience, safety, comfort, and affordability are also important factors in addition to proximity. And so when looking at park density in North Sacramento, for example, at first glance, it seems that most residential areas are located within half a mile of a park. However, with our understanding of health outcomes and built environment characteristics, we know that people may not be using their nearby park due to factors such as high-speed streets, unsafe crossings, non-existent sidewalks or bike facilities, and other barriers that make walking and biking to parks unsafe, inconvenient, or uncomfortable. Next slide, please. And so again, HPI's data on health outcomes can kind of help us tease out this connection to active transportation. So again, while at first glance park access might seem good in North Sacramento, high chronic disease rates indicate that there is still something else at play. And so we can then use this to support our claim that investment in safe active transportation infrastructure along routes to parks can lead to substantial chronic health benefits. Next slide, please. So lastly, I wanted to talk about how we've used HPI in a successful ATP application as well. We recently supported the San Juan Unified School District in applying for a Safe Routes to School infrastructure and non-infrastructure project that included several schools throughout the unincorporated Sacramento County and city of Citrus Heights. In discussing current health vulnerabilities, we identified Sacramento County's top 3 health concerns, which were outlined in their 2016 Community Health Needs Assessment. And chronic disease was one of these top focus areas. Next slide, please. And so we used HPI to identify chronic disease indicators for Sacramento County, including, again, some health outcome decision support layers, such as asthma emergency department visits, heart disease emergency department visits, and diabetes. We were then able to make the case for Safe Routes to School focused active transportation improvements by showing that chronic disease prevention is both a priority for the county as well as a demonstrated health concern, especially for youth and children. Next slide, please. Wrapping it all up, I wanted to leave you with some key takeaways for how to apply HPI in active transportation efforts. So firstly, make sure to always think of mobility as an environmental justice and health equity issue. When people can't access high-quality jobs, educational opportunities, green space, and healthy foods because they don't have access to a car, and there is no safe way to get around otherwise, their health is at risk. With that frame of reference, you can easily show how active transportation connects to the various social and physical determinants of health. Make sure to also understand the key health concerns for your community, and then describe how active transportation can address those concerns. So again, for Sacramento County, chronic disease, as well as mental health were among the top health priorities. Active transportation provides benefits to both, especially for children and youth. Then show how social and physical factors impact health. Tell a story with your data and make sure to pair maps and data with community voices and on-the-ground conditions to make a strong justification for active transportation improvements. And lastly, the most important piece is to tie it all together. So always tie everything back to active transportation and really highlight that connection between active transportation, access to opportunity, and health. And that is my presentation. Thank you.
Fantastic, Alicia. Thank you so much for that very informative presentation. I am going to keep us moving along. We are doing really well with time right now, and we're moving into the question and answer period of our session. Okay, so very good. So I'd like to first unmute, make sure that Helen, Bill, and Neil are all unmuted. Bill, Helen, and Neil, can you just say we're here?
We're here.
Okay.
I'm here.
Yep.
Great. Okay, so we've got one question so far, and I'd like to encourage those of you that are on the call to use this time to ask questions of our esteemed panelists. First question is, how were the transportation measures determined? It seems like collision rates, especially for vulnerable users, including bicyclists and pedestrians, is a major health issue that is missing from the HPI. Also, walkability scores and transit transit access seemed to be missing. Neil, would you be able to respond to that first question?
Absolutely. So this was part of the evolution of the HPI. Earlier versions of the HPI actually included a health domain, which included both bicycle and pedestrian fatalities and serious injuries. In talking this over with our steering committee, we came up with sort of the impression that it's like, you know, if you're supposed to be predicting a health outcome, but you already have a health outcome included, it's sort of circular reasoning. So we decided in the current version of the HPI to not have any health outcomes per se, and the fatality rates of pedestrians and cyclists would be included as a health outcome. So you'll see that in all of the policy action areas of the HPI, we don't have a health indicators themselves. They are in the decision support. So in fact, you will find pedestrian and cyclist fatality rates in the decision support layer. So you can contextualize that in conjunction with the overall HPI score or any of the individual policy action areas. So that was our approach. It left the HPI more interpretable as just the living conditions or community conditions that produce health apart from the health outcomes themselves. So that was our approach.
Perfect.
The domains, you know, the individual indicators that we chose, though, around vehicle access and healthy commuting was something, again, we look for indicators that had evidence behind them. In fact, all of the indicators, you know, were subject to a literature review and a screening process. So those were the two indicators that were, you know, strongly associated with life expectancy at birth in and of themselves, and reflect physical activity, especially the healthy commuting one.
Great. Thank you for that, Neil. So we have another question. How do you collect health data by demographic area for HPI analysis?
Maybe I should take that one as well.
Okay.
You know, there are 9 individual data sources that comprise the 25 indicators in the HPI. As I pointed out, none of them are health indicators in and of themselves. This is where our decision support layers come in. And there we use a number of different data sources to collect health information. Some of them are based on the 500 cities study that Centers for Disease Control has, where it's census tract level prevalence of many common chronic diseases like asthma and diabetes and heart disease and many others, as well as the risk factors like smoking or binge drinking or things like that. Some of the indicators come from OSHPOD, so the the rates of emergency room use or hospitalization come from those sources. So we use a number of different sources that provide a snapshot on just the overall community prevalence of the condition, but also some of the more severe outcomes when it comes to hospitalization or ER use.
All right. Those are, thanks so much, Neil, for weighing in on that. I'm just going to look to our other presenters to see if you have any additional insight that you might want to share on those two particular questions. And I believe you have this, you can actually see some of those questions. I think those questions are actually coming in to all panelists, correct? Okay. No?
Yeah, I can see.
Okay.
I think the other thing I would want to mention is that in the decision support layers, I think there was also a question about transit access. That's also available within our decision support layers. And I should note that for one of the criteria for our indicators to be included in the Healthy Places Index beyond not being a health outcome but associated with health or life expectancy at birth is that they also needed to be available at the census tract level from a public source across the entire state of California. So there are a number of popular indicators for transit that might be available, but they're just not available at either the granularity that we required or from a public source. But you can always check our decision support layers as we have a number of indicators in there that don't necessarily meet those criteria.
Okay, thank you so much for that addition, Helen. Okay. More questions from our attendees. All right. I might ask Alicia to just talk a little bit more about the use of the tool in working with sorry, I'll back up. I don't have my question fully formed yet, so let me think about this. All right, the use of the tool. Oh yes, I'm sorry. So I was going to ask about the use of the tool in relation to the work that you do that focuses on the physical walk audits that you do in neighborhoods. Do you feel like you've used HPI and the data outputs to help move that process along, or were those, how have you used those processes and tools complement in a complementary sense?
Yeah, so we often do, just a little bit of background for Walk Sacramento, we do a lot of walk audits with, in conjunction with school communities, with community groups, as well as with our agency partners. And what we pull out of that is we create walk audit reports with a series of recommendations for various infrastructure and program improvements. And so to Victoria's question about how we use HPI as part of that, the short answer is yes, we've been using it, and kind of along with CalEnviroscreen, and so those are really the two tools that we use. And what we like to put together in our walk audit reports is some general existing conditions background, which provides that community level overarching data and kind of visual representation of health conditions, and then using that as a starting point for having those discussions with community members and with agency partners on our walk audits to say there's a definite health need in this community, and here's how we can, what did we see on this walk audit that could actually help move our recommendations forward to improve health.
Thank you. All right. Really hoping to drum up more questions from our attendees.
I have a question, sort of a review question. This is Marianne. For you, Helen, to make sure I understood. So we have a neighborhood and we show some indicators where some health indicators that perhaps need working on. And then from there, people are referred to the Actionable Policy Guides, and then embedded in there, you showed a table where there are many recommendations for people to go ahead and move on. Is that correct? So you go from map to the guide to the recommendations specific to a neighborhood?
So it's the guides are specific to an indicator. And so we have policy guides for each of our Healthy Places Index indicators, but not for all of our decision support layers. So for example, our health outcomes don't have policy guides associated with them, but any of the indicators associated with the Healthy Places, we do have policy guides for any indicator that's within the Healthy Places Index. And the policy actions are not yet location specific, but they are indicator specific. So to access those, you can click on any census tract in California or any geography, depending on what you have set. You'll get a list of those indicators. You can drill down and click on a specific indicator, and then you can click off into the policy guide. There's that little section that says policy actions to address this indicator, and then that will take you to the policy guide that provides various examples for addressing that particular indicator in general that could be implemented in your jurisdiction if there is interest in pursuing an ordinance or something along those lines that's within the policy action guide. Does that make sense?
Yes. Okay. Thank you.
Great.
And this is Bill. I'll just add to that too. If you look at a lot of the guides, they do have examples from a lot of communities in California that have implemented health promoting policies. And in particular, if you look at the transportation ones, the active commuting and the automobile access, there are a lot of the recommendations in there are about creating an active transportation plan or implementing a safe routes to school plan, or applying for ATP grants or other types of grants for projects. So you'll see in those two in particular, you could almost lift up a lot of those recommendations as evidence for why you're pursuing a certain type of grant from ATP as part of your application.
Thank you.
Great. All right, we've got another question coming in. What would you consider to be the best core metric for the built environment that better predicts health than number of persons who live within half a mile of a park? So I think I'm going to start with the Alliance team to consider that question, and then Alicia's going to think on it a little bit more. She's smiling here, and I think she might be able to weigh in as well. So again, what would either of you consider to be the best core metric for the built environment that better predicts health, the number of persons who live within half a mile park? And I wanted to also preface this, or add on to this question. We're not necessarily, from a public health standpoint, from a public health professional standpoint, we often are looking for, I know that in the community, there's often like, what is the one indicator that can kind of give you the answer that you're seeking. But clearly, we're here today because we need to look at a combination of metrics to kind of really define needs of the community and to look seriously at conditions that feed into to health. So, but I think, yeah, this is a fair question to look at, like, what's really the primary core metric that you would consider for for identifying the built environment predictor of health.
Yeah, this is a really challenging question. It's a really good question, a very challenging question. I mean, first of all, I should just point out that, we have, in our built or our neighborhood domain or policy action area, we have a number of different indicators. They include things like retail density and tree canopy and a number of other indicators that are often used. When we correlate them among themselves, we find that they are often intercorrelated. There may not be one that stands out. And when you correlate them with life expectancy at birth, they're generally actually kind of weak predictors of life expectancy at birth. That's from a very sort of mechanical, statistical look at things. So, that's why they're measuring different aspects of the built environment. That's why we combine them into one domain. So we take individual scores on 5 or 6 of these different neighborhood or built environment characteristics. We can create a composite average, and that's what we're using. And that seems to be, an approach that other folks do as well as weighting that domain in the overall score. So in our case, we can't say that there was, one that stood out. They all were intercorrelated with one another. They were collectively, not super highly predictive of health outcomes, which is pretty much what the literature says as well. We're aware of other kinds of, park access actually was one of the indicators, so it doesn't perform all that differently than the overall average. Because I think someone else pointed out, how come we didn't use like walkability scores and other things? Well, part of the reason why is that some of these other indices are private. They're not public. Their methodology is a little bit opaque, and in the interest of total transparency, we wanted to make sure that people, were able to understand how we computed these values, and that they were based on public data sources, and that there wasn't a secret recipe that no one else could see, anything like that. Because we know that some of these other scores are a lot of hype, a lot of commercialism around them, and things like that.
And then I think I would echo what Neil said about how there's not necessarily one core metric for the built environment. That's always something that we've struggled with identifying as well, just because a lot of the time, as this question mentions, like number of people who live within half a mile of a park, again, looking at it from the North Sacramento example that I gave, it looks pretty good. But when you look at the actual built environment conditions, it's not conducive to walkability and not conducive to health. So we end up finding a lot of different ways to, or a lot of different indicators to show that. Tree canopy is a great one, actually, especially in Sacramento. I didn't have it in this presentation, but we also have there's a really great map that the Sacramento Tree Foundation put together that shows a dot map of people who identify as Black and African American compared to tree canopy, and it's basically inverted. And so that was a really great comparison of how, and then overlaying that with health outcomes too, it really shows how tree canopy can be an indicator for health in the built environment. The other things that we often look at are things like speed limits on streets as a proxy for showing arterials and for collectors. We often find that a lot of high-speed streets are within the communities that have a lot of poor health outcomes. And then similarly, with our Safe Routes to Parks and Healthy Retail project, the City of Sacramento has a Vision Zero Top 5 Corridors study, which shows the top 5 segments where there's the highest number of pedestrian and bicycle, or maybe not specifically pedestrian and bicycle, but the highest number of collisions in Sacramento. And so I think it was 4 out of 5 of those corridors were actually within the North Sacramento and South Sacramento community areas. So again, that's kind of a proxy that we've used and for us to show how the built environment how unsafe conditions of streets can kind of lead to those poor health outcomes. But we're also not as technical or and don't have those research to really show those linkages. So again, these are really just proxies that we use.
Yeah, I think I'll just weigh in one more time. The example that Helen gave, where we looked at those 3 different economic indicators. So if we were to ask the question, what's the best economic indicator, and you only picked, living in poverty, you would, or just employment or unemployment, you would actually miss quite a bit, and the strategy that you would pursue would probably be, incomplete. So I think looking at a number of the different indicators within the neighborhood conditions domain, gives insights where, let's say, tree canopy is high, but it might be access to parks is low. And then sort of looking at the heterogeneity of the different indicators could lead to specific areas that you want to follow up on, rather than just thinking that only one indicator will reveal everything. So,
thank you, Neil. Appreciate that. I actually had a question, and I'm going to pose this for Bill. If you're looking to do a complete streets policy in your community, or in your neighborhood, and Bill, how would you think about using? How would you talk about using the HPI tool to advance that conversation or that policy development? So again, kind of not just active transportation specifically, but more around complete streets. I know that there's a lot, and I asked this question specifically because there's a lot of, it's a priority within our state transportation department, and I think that they're also interested in the equity lens for complete streets implementation. So sorry I don't have that in writing for you, but if you could just maybe, given that scenario, how would you, as an HPI expert, how would you go about kind of using the tool to start those discussions?
Sure, and I worked on complete streets policies a decade or so ago when they were first coming to fruition, and I would have loved to have a tool like this to use, because I think it really has a lot of really rich data on community conditions that can help you, I think, both identify areas where, areas of priority where complete streets improvements could be beneficial. Not only, it doesn't get at the granularity of like identifying specific streets and using, the injury data and other sources that we typically use, but it can provide the broader context of where there's less healthy community conditions and where some of the social determinants would come into play with where improvements could be made. And it also brings that broader health lens into those conversations, in that, by completing a street, by making walking, biking improvements and making it safer, you're essentially making the community a healthier place. It goes kind of hand in hand with the other types of indicators in HPI. It's part of the transportation policy action area that you're improving the area. So I would say, the data itself could be really useful. You could use the HPI score in looking at certain communities that you want to focus on, or just making the case for why it's important. You could dive into the transportation specific action area. You can look at some of the health outcomes as well and trying to explain, that obesity or physical activity or other types of chronic disease, there's high rate concerned communities that would benefit from it. So I think, I see it as a tool that can provide other types of data and other perspectives to be looking at it more holistically on a complete streets project than just making the actual infrastructure improvements and trying to really benefit and improve the community's overall health with those types of policies.
Great, thank you so much, Bill. Anything? Yeah. Okay. Fantastic. One more question from within the room here. So, if a local agency is looking to do specialized work with a particular population, whether it's a school age group or, say, an older adult group, they want to develop some kind of walkability initiative, is there a way that you can use the tool easily to draw out specific demographic data on a specialty group to speak to their specific health needs or health concerns? And I'm not sure who on the Alliance team could answer that question.
Well, I'll start. I think we'll have some others contribute. Helen pointed out in the decision support layers that you can identify census tracts by their race and ethnicity percentages. in our climate change indicators, there are a number of indicators for older age groups, both living alone and just over the age of 65. So you'd be able to identify certain subgroups by using those decision support layers, the first identified, the ones by age. And I should also point out that ages below 5 are also included in the decision support layer. So there are ways that you can leverage what's in the decision support layers in conjunction with the HPI.
Excellent. Okay. All right. Last call for questions. And if not, I have a few more slides and announcements that I will get to before we end our webinar. We have allotted until 3:30 for question and answers, but seeing none, I'm just going to continue to move us forward. I know that our presenters have given us a tremendous amount of information, and I know I need to sit with it a little bit more. Very in-depth presentation from the Alliance to give us really, to showcase the power of the HPI, how it can be used for planning purposes and then very practical purposes related to the Active Transportation Program, upcoming call for projects. And then Alicia, thank you so much for sharing your story and what you've been doing through Walk Sacramento and how you've been using the HPI tool very practically to advance your work in safe routes to parks and also on the environmental justice and general plan element for the city of Sacramento. So thank you all for your wonderful presentations. So just to close out slides, your feedback is important. Please, 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 at the end of this webinar, complete the survey gizmo that will pop up. This is an important feedback mechanism for the Active Transportation Resource Center to know if we're on track with helping you through the provision of these webinars. You'll also have the opportunity to ask for additional technical assistance from the ATRC in the survey gizmo. And yes, you will be able to get a copy of the slides and the recording that will be sent out in post-communications. So next slide, please. So next, this is a reminder for those of you on the call, you can stay up to date on ATP Cycle 5. Our best suggestion for that is to make sure that you visit the California Transportation Commission's Active Transportation Cycle 5 webpage, and note that the expected call for projects is March 25th, which is just a little more than a month away. So lots of other important dates that we'll be sure you'll have in the slide deck when we send that out. Next slide. I wanted to highlight that there is an opportunity for in-depth technical assistance for ATP Cycle 5 applicants that are serving disadvantaged communities. 10 communities statewide will be selected for this special technical assistance, and that assistance will actually be provided by the local government commission along with consultants from Rails to Trails Conservancy, as well as Spheres and Peers. If you're interested, please complete the Technical Assistance Interest Survey. There's a link available on the slide deck, and you should have also received the announcement through the Active Transportation Resource Center listserv. Note that the surveys, interest surveys, are due Friday, February 28th by close of business 5 p.m. Next slide. All right. Just always a gentle reminder that the Active Transportation Resource Center encourages you to check out our website for existing training resources and technical assistance opportunities. This is where we will be posting a recording of today's webinar along with the slide deck and other resources that were mentioned in this webinar. Then this will probably be up in about a week or so. Thank you. All right. And this is my last slide. On behalf of the Active Transportation Resource Center, I'd like to thank our wonderful presenters, Bill, Neil, Helen, and Alicia for sharing their time and their expertise today. I'd also like to give a shout out to the California Department of Public Health team in Sacramento, Marianne Hernandez and Joseph Kincaid for their technical support for this webinar. And last but not least, thank you to everyone for joining us on the call today. We'll be following up in the coming days with a link to the recording and links to the resources discussed. But in the interim, please feel free to reach out to the Active Transportation Resource Center and or our presenters with any questions you may have that we didn't have time to answer. I think we answered most of them. On that note, we're signing off. Thanks again, and please enjoy the rest of your day.